All right, welcome to the MGH Healthy Lifestyle Program webinar series. Today we have Dr. Seth Gale with us to present on brain healthy behaviors for successful cognitive aging. And I'm going to review a few opening items for our webinar today. So this webinar will be 45 minutes. We'll wrap up at 1 p.m. This webinar will be recorded and will be posted to the MGH Healthy Lifestyle Program YouTube channel. Your video and audio are off and cannot be connected. And we encourage you to ask questions through the Q&A feature or by sending a chat to host and panelists. We'll do about 35 minutes of a presentation, or 30 minutes rather, and then we'll have 10 to 15 minutes for questions. So please do send in your questions. All right, and I will pass it over to Dr. Seth Gale.
All right, thank you very much, Amy. Let me share my screen. And thank you for inviting me here, and I look forward to sharing this information with everyone. So what I'll do, as Amy said, is I'll spend about 30 minutes here and then leave some time for questions. The topic of my talk is brain healthy behaviors for successful cognitive aging. So I'm a neurologist. I work mostly in cognitive and behavioral disorders like cognitive impairment and dementia. But I have an interest in brain health broadly, which is a big topic we'll get into, and the promotion of brain health. The Center for Brain Mind Medicine at Brigham and Women's, which is on the bottom here, is a multidisciplinary center that has neurology, neuropsychology, social work, and neuropsychiatry, all part of clinical care. But we also run various groups for promoting brain health, for living with neurologic illness. So it ties very nicely into the goals of the Healthy Lifestyle Program at Mass General. All right, so let's talk about brain health. So I have no relevant financial disclosures. Okay, so what we'll do is we'll talk about the modifiable risk factors related to dementia and cognitive impairment, along with some consensus recommendations from the major professional societies about what's good for dementia risk reduction. I'll give a background on this spectrum that we call it from normal cognitive aging to what we call dementia. And then I'll just highlight some of the research that supports these lifestyle and behavior changes for dementia risk reduction. And there's some interesting mixed results there, generally favoring what we imagine is good for brain health, but with some discussion points. And then at the end, I'll leave you with some practical, translatable information from this research that will hopefully help with promoting a healthy brain. And we'll move on from there. All right. So to get started, some basic background facts. So there are over 7 million people that have Alzheimer's disease or related dementias in the US, and a larger number globally. And it's just notable that a majority of those are in lower and middle income countries. And so really there's a topic for another talk, but there's a lot of global health initiatives related to brain health that, that the US can tie into. Up to 20% of adults 65 and older are likely to have some mild cognitive disorder, which I'll get into a bit, but that would be considered different than normal cognitive aging. So either a risk factor or what we might call a prodromal stage to dementia. So Black Americans have two times higher risk than their white counterparts in having some Alzheimer's disease or related dementia. And we know Hispanic Americans are 1.5 times higher. This is due to various factors, including comorbid health conditions, higher rates of hypertension, diabetes, etc. So this is really an issue that disproportionately affects those populations. It impacts all of us promoting brain health, but we have to pay special attention, especially in clinical care, to making sure we're reaching the populations that really need this information the most. So we know on a population level that delaying the onset of dementia, even by 5 years, so say a brain healthy lifestyle can can either delay the symptoms of onset or even reduce the incidence of impairment, can decrease the total prevalence of Alzheimer's disease and related dementias by 50%. And this is because the biggest risk factor for those conditions, ADRDs, is age. So the longer we live, the higher risk we have. But if you can delay that, you can basically reduce the overall prevalence of these diseases. And there's a huge cost. There's financial cost, of course. There's caregiver burden, family stresses, and all of those, which kind of add to a huge burden on health systems. Okay, so modifiable risk factors. This is the key, and this kind of leads into healthy lifestyle. So risk factors for dementia, you can see the schematic on the left. So going from early life to midlife to later life, these bubbles represent the various risk factors that we know add up to contributing to risk for Alzheimer's disease and related dementias. If you look at any one of these, you can see percentage numbers that if we were to get rid of that factor, say depression or social isolation, then we would reduce the prevalence by that percent of these diseases. So we call that attributable risk to dementia prevalence. So the main take home is that 40% of all of these factors throughout life are potentially modifiable through lifestyle change, behavior change, control of medical conditions, etc. So that's a huge actionable piece of information, both on an individual level as well as from the public health and population standpoint. And just to show a couple of these to zoom in on this, so things like hypertension or high blood pressure, hearing loss in midlife, obesity, traumatic brain injury, these are examples of potentially modifiable risk factors to reduce dementia prevalence. And then in later life, just to focus on a couple, physical inactivity has some contribution, smoking, social isolation, in particular, social isolation, and I'll highlight also air pollution, just because there's been some more recent large population-based studies showing the correlation between air pollution, for example, and incidence of cognitive impairment. These are complicated social and political issues, of course, when we're talking about cities and countries, but at the same time, they're important to recognize that they're contributing factors. All right, so just another schematic to take home point. If you look at the top here, these are all of the factors that we know increased risk of cognitive impairment and not having successful cognitive aging. And that includes, as I mentioned, midlife high blood pressure, diabetes, history of depression. And again, to emphasize, this is kind of untreated depression over time, rather than, an episode of depression or grief or that sort of thing throughout life. And then there are certain factors that decrease cognitive decline, that decrease brain health and lead to more cognitive decline, including less physical activity, Mediterranean diet. I may have reversed these two things in my talk here compared to what the slides look like, but essentially the things on the bottom in green are behaviors and activities that we know decrease cognitive decline risk. And you can see the level of evidence as indicated by blue with the strongest evidence, and yellow with less, and green with emerging evidence, but less clear. Okay, and this just to show that in the medical world that it's agreed upon by these professional organizations and specific specialties within medicine, like the American Heart Association, National Academies of Science, et cetera, that there's a host of brain healthy behaviors and lifestyles, if you will, that reduce dementia risk and are recommended for successful cognitive aging. But there's not total consensus. You can see that of these 5 organizations here on the top right, the Institute of Medicine, the Alzheimer's Association, the American Heart Association, that everyone agrees and recommends that physical activity is important and is a modifiable risk factor. Likewise, all organizations agree that treating cardiovascular risk factors like high blood pressure is important. But in their guidelines and kind of white papers to public health and officials and to providers, everyone doesn't agree on other things like managing depression and stress and managing hearing and visual impairments. And I think a lot of this has to do with the robustness of evidence that's emerging. What you'll hear in this talk are general guidelines from a bunch of research, just to highlight that from this slide that it has not yet reached in some of these categories the degree of robustness needed for guidelines from these organizations. Okay, so with that background, let's talk a little bit about this spectrum from what we call normal cognitive aging to dementia. And so I want to start with having people keep this graph in mind to the right here as we go through, which is on the x-axis is age. So as people get older, you would progress along one of these curves, either purple or blue. And on the y-axis here, the arrow facing up is cognitive function. So first, taking a look at the top curve, this is what we would call normal aging or successful cognitive aging. And you can see that there is some decline, that people have some decline with what we call normal cognitive aging. And also to point out, this is an average curve. So this is not the curve for everyone, right? The idea is to try to have any individual optimize their cognitive aging curve and have this look a little bit less sharp, for example, for everyone. And as a model, this blue curve represents a curve of disease, that there is something going on that's different than normal cognitive aging. And again, it's a spectrum there as well. You could imagine someone's curve is in between these two curves, for example. We have markers for Alzheimer's disease at this point that can identify that there's some process going on in the brain that can put someone on a disease curve, but we don't have that for all of the dementias yet. It's a subject of research, but all that to say, keeping this in mind will be helpful for these next couple of slides. If we go all the way to the beginning part of this disease curve, you can see subjective cognitive decline, or SCD, is listed, and preclinical or asymptomatic disease is up at the top. So the reason those terms, just to define them, subjective cognitive decline is when someone experiences worsening memory loss or cognitive changes. They have a subjective experience that's happening, but they perform normally on objective memory testing or cognitive testing, even sometimes detailed cognitive testing, what we call neuropsychological evaluation. Then the next category we'll call mild cognitive impairment. It's a term that people may have heard about, which again is along this curve, especially if someone has evidence of disease. And this is MCI, or mild cognitive impairment, is a condition in between having no symptoms but potentially markers of a disease, which is preclinical or subjective cognitive decline, and having some actual impairment on testing, but it not interfering with daily functioning yet. And that's what we reserve this term dementia to describe, which is that someone has abnormal memory and thinking compared to what we would expect for their age and education, but they have no interference with daily functioning for mild cognitive impairment, And for dementia, we observe that in what we call instrumental activities of daily living, like cooking, driving, doing personal finance, paying the bills, managing medications, these sorts of things, there's been interference with those activities. So that's all that term dementia means. It means that there's actual interference with day-to-day functioning. You can have abnormal cognition based on testing, but no interference. You're compensating well for the potentially the changes in the brain, and it hasn't interfered yet with your daily functioning. So all this to say that the idea is just to paint a picture that there is really a wide spectrum, and the idea of healthy brain healthy behaviors is to try to optimize and keep people on the best curve that they can. And even if they have markers of a disease, that curve for disease can be modified some, become less sharp with brain healthy behaviors. All right, so that's the background. So a little bit of a discussion about past and current research that supports these brain healthy behaviors that I'm describing, and I'll describe in detail in the last section as well. So just to start, so there is really a robust set of both randomized trials where you study people going forward, and large population studies where you follow people over years and ask them at points to report their behaviors, things like exercise, social stimulation, general physical activity, and diet, for example. And so just to show a couple of those studies, so here on the left, this is evidence from the Northern Manhattan cohort. So there were two cohorts of almost 2,000 people followed for up to 12 years. You can see that in these graphs here, that these different lines on the graph sort of show the probability of remaining free of dementia over time. These are cognitively healthy older adults who start the program. They have no memory impairment. And over time, if the curve goes down, then those people in that group, which I'll explain in a minute, are developing dementia. They're getting cognitive impairment. So you want to be in the black line at the top here, the least sharp curve, because then it's evidence that over 10 to 12 years you haven't developed any cognitive impairment or dementia. And this black curve actually indicates that the people in that group had the most physical activity and the highest adherence to a Mediterranean diet, what's called a Mediterranean diet score. And subsequently, or additionally, these other curves had lesser degrees of physical activity and lesser adherence to a Mediterranean style diet. So this is some evidence that supports that it's the synergy together of brain healthy behaviors likely that reduces overall cognitive impairment risk, rather than just saying, physical activity is the most important thing, diet is the most important thing. And likewise, in another foundational study, here done in Sweden, here were up to almost 800 older adults, 75 and older, who were followed over years. And it was demonstrated in this study that, again, it was a combination of physical, mental, and social activities that made a difference for being less likely to develop dementia than those who participated in just one. And if you look at some of the details here, for those that had a high score in all of them in mental, physical, and social activities, they had a much less chance of developing dementia than for sure those who had a lower score in those activities and even a higher score in one of either mental, physical, or social components. So again, this is all a comment on the combination of activities that I'm describing and will describe in the last part that are really beneficial. Okay, so to talk a little bit about diet. So people may have heard about the MIND diet, M-I-N-D, or the Mediterranean style diet, and even the DASH diet, the dietary approaches to start hypertension. Those are all listed here. So these are also long-term studies showing that adherence to, so we'll start at the top, the DASH diet, which is characterized by low consumption of saturated fats and sweets and a higher consumption of dairy. I should say that both the DASH and the Mediterranean diet are similar with these differences I'm describing, and the MIND diet is a sort of combination of these two, but they're all getting at the same thing, which is anti-inflammatory properties and foods that are generally good for the brain. In the Mediterranean style diet, the primary fat is olive oil. There's moderate consumption of alcohol, for example, in that diet, and there's higher consumption of fish than in the DASH diet. But in any case, to highlight, so following 800 plus participants over time, this is in the Rush Memory and Aging Project out of Chicago. This just demonstrates that both of these charts demonstrate that those in the highest adherence to these diets, which is the blue lines indicated in these charts, had better cognitive scores over years compared to those that were in the middle and bottom tertile of participants in this study. So this is a single brain healthy behavior of dietary adherence, but even here, we see that compared to less adherence to diet, those with the highest adherence had the greater cognitive scores over time. And just to throw something in the mix that I mentioned before, that looking forward in a randomized control trial for the MIND diet, which was just published this year, a month or two ago, this study, the MIND trial, showed that there was actually no significant difference in global cognitive scores between the MIND versus a control diet over 3 years. This was also cognitively healthy older adults, 65 or above, who had a family history of dementia and self-reported poor diet at the time of the trial. I think it's notable in this study, though, that both arms of the study, those that were followed the MIND diet and were actually given food supplies over the course of the 3 years and had dietary counseling, compared to a control diet, a control arm, which had some general advice about calorie restriction, but were not supplied with food and did not have any intense dietary counseling towards a particular diet. That both of those arms had some improvement of their cognition over time, but that there wasn't a significant difference in the MIND diet compared to the control diet over time. So again, I think the consensus in the field is this doesn't change the robust evidence about diet and other brain healthy behaviors that we know from a population level, meaning when you follow people over 10 plus years and report their behavior. But it is interesting and highlights the challenges of trying to do studies in a randomized and prospective way. And there needs to be follow-on studies to kind of look at this, to challenge it, or to corroborate this finding moving forward. All right, and I'll highlight 2 other studies, I think. One is the FINGER study, which was done in Finland, and this was a multi-domain lifestyle study. So they looked at group cognitive training, individual exercise, nutritional counseling. This was very intensive, multiple times per week, over 2 years, with also in cognitively healthy older adults aged 60 to 77. And this study, as you can see in this chart here at the bottom, had a primary outcome of a cognitive battery of tests. And this did show a difference, a benefit in the intensive multi-domain lifestyle intervention over 2 years compared to just a control group that had just health advice. Again, these were patients who were older, they had some risk factors for dementia, and they engaged over 2 years in this study. So this is a really meaningful outcome, and had not been showed prior to the study that that a multi-domain lifestyle intervention could positively impact people's thinking and cognition. So again, all this to say that it's probably multiple domains: exercise, nutrition, social and cognitive stimulating activities that are going to lead to successful cognitive aging and reduce cognitive decline than any single one by itself. And there's a number of follow-on studies to the finger study, one of which is being conducted in the US, which is called the Pointer study, which is interesting to read about. And hopefully these results will be replicated. And finally, the Sprint Mind trial, just to say briefly, blood pressure control for people with high blood pressure intensively with a systolic blood pressure, a high top number less than 120, significantly reduced cognitive decline, the risk of mild cognitive impairment in this study, to the point where this study was stopped for benefit in the arm to make sure that people were not missing out on intensive blood pressure control. So blood pressure is important to control, especially for older individuals. Uncontrolled blood pressure is itself a risk factor for dementia and cognitive impairment. All right, so just to finish with hopefully some practical take-homes from all of this. So I really like this schematic here because it's a nice visual to sort of summarize a lot of this. So you can see that all of these brain healthy behaviors, so physical activity, adherence to a healthy diet, social activities, cognitive activities, along with managing overall health and mental health, wellness, stress management, and then the very medical aspects like medication management, and as I've discussed, control of blood pressure and other cardiovascular conditions, all leads to protection of the brain and risk reduction or prevention of cognitive impairment. So specifically, aerobic physical activity, so activities that achieve a goal of that requires moderate and consistent effort over months, is beneficial. So there have been studies, as highlighted here, that 30 to 60 minutes of cardiovascular exercise 3 or more times per week was associated with lower risk of progression from mild cognitive impairment to dementia, and that these benefits can also be seen to some extent in people who already have cognitive impairment already, or who are at risk for dementia. And this is just to highlight that this can be done in different ways. People can get cardiovascular exercise from all of these listed here, in addition to chair cardio exercise for people who have some walking disability or other disabilities. So what you want is you want to increase the heart rate, you want to feel slightly out of breath and sweat lightly. These are again, you could sweat more than lightly, but to demonstrate that there's cardiovascular activity and blood flow to the brain going on, it's often the case that people have these features when they exercise. For diet, as I mentioned, there are many studies, especially these large population-based studies, showing that the anti-inflammatory diets, like the MIND diet and the Mediterranean diet, are both brain and heart healthy, and that there's greater adherence to these diets leads to a lower rate of risk of conversion from cognitive impairment to dementia. And just to highlight in this traffic light design at the bottom here, that fresh fruits and vegetables, beans, lentils, nuts, fish, whole grains every day are recommended in a Mediterranean diet. in moderation are dairy, eggs, poultry, alcohol, and to avoid products with saturated fats and processed sugars, refined sugars. So social and cognitive stimulating activities have been demonstrated to preserve memory and processing speed, that they have through the lifespan, that there's benefit in mid and late life, have been shown to have protective effects of having increased social and cognitive activities. These are just some examples here, like keeping the brain active with crosswords, jigsaw puzzles, boards, card games, social and cognitive combined activities like group classes, arts and crafts, continuing education, etc., are all beneficial. Again, we know that over time, when people report, I've done these activities over the last week or over the last month, over years, that those individuals have less risk when you control for various factors than those who are not mentally and socially active. And again, it's not one thing or the other. It's not that so-and-so likes to read books, and so therefore they're going to have successful cognitive aging. You can get this type of social and cognitive stimulating activity in whatever ways that you enjoy doing. There's no evidence that one is better than the other. And just to highlight this study at the bottom, that there's social network size was correlated with a reduced risk of dementia. That is, that how many people this group of older women in California interacted with on a weekly basis was protective. The more that they interacted, the larger their social network size, it was correlated with a reduced risk of dementia over time. All right, and to finish up, sleep plays a key role in memory and attention function. Poor sleep is associated with markers of Alzheimer's disease, and we know this from a lot of research, that things like the plaques and tangles, the amyloid pathology, and the tau proteins in the brain are associated with poor sleep. And it's a bit of a catch-22, where chronically poor sleep over time, again, as one factor, is a risk factor for development of Alzheimer's disease and related dementias. It's not the only factor, but if we can optimize sleep in our adult life, we are reducing our risk. There's a bidirectional relationship between some of the underlying brain changes and sleep. And some of that, just to show this complicated slide very quickly, on the left, if you look at this, the spectrum from normal aging to dementia, Alzheimer's dementia, as I showed below, the poorer sleep you have over time, sleep fragmentation leads to change of the patterns, the sleep waves in the brain, which leads to less clearance of bad actors, toxins in the brain, leading to more accumulation of these toxins, and eventually symptoms of cognitive impairment or dementia in those who have often multiple risk factors for these diseases. And this is kind of leads to then impairing sleep, making sleep worse, and having like kind of a negative cycle of making the problem worse. So in general, focusing on sleep and doing what one can to both treat sleep disorders like sleep apnea or restless leg syndrome, or or insomnia that can be treated with other things, is really important. People may have heard of sleep hygiene, or the idea that being consistent with your routine of sleep, making sure that the environment that you sleep in is relaxing, quiet, and dark, avoiding large meals, caffeine and alcohol before bedtime. These are all things that we call sleep hygiene, are important ingredients to try to optimize one's sleep. And of course, being treated for medical sleep disorders, either with medication or in the case where there's like psychological components, of having certain therapies that have good evidence for helping with insomnia. Keeping blood pressure low, treating cholesterol with whatever mechanisms you decide with your doctor, making sure that diabetes and sugar is controlled, keeping body mass index or general weight in a healthy way, and addressing depression and mental wellness are all key. These are the sort of the medical and psychiatric conditions that can worsen cognitive impairment and can lead to risk of dementia. And I'll leave you finally with this, which is that part of the goal of all of this is to build reserve in the brain, to build your cognitive reserve. And this is a topic for a whole nother talk, but to plant this idea in people's minds, if you look at, again, this graph we introduced at the beginning, that if you're on a normal cognitive aging curve, but you have a more robust brain over time because of these protective lifestyle behaviors over time, then you can have greater cognitive function sort of for you at the same age. And that's indicated here by this up arrow where the curve has been pushed up, this blue curve. And that's even the case for people who are on an unfortunate like decline due to disease, that high cognitive reserve can sort of delay further progression and also therefore lead to better quality of life and better wellness. And these are the factors that lead to cognitive reserve over here on the right. Modifiable risk factors we discussed at the beginning, keeping the brain active with cognitive training, and having adequate social and community support. These are some resources to reference back for those interested. And I thank you for this whirlwind tour of successful cognitive aging. Happy to chat and answer questions.
All right. Thank you so much, Dr. Gale. This was such a fascinating talk with so many important and tangible takeaways. And I want to say thank you for making the topic of cognitive aging to be so positive and empowering by sharing this valuable information. And
Sure.
so we have time for questions. We have a couple questions coming in already. So if you arrived a little bit late, please feel free to type your questions in using the Q&A feature. This is a great opportunity to get your questions answered. But I'm going to start with the first question that we have coming in. So you were talking about building up that cognitive reserve. So what suggestions would you have for somebody who feels like their cognitive reserve isn't as full as it could be, and maybe they're starting to notice some of that subjective cognitive decline? Are there any resources or tools that you could recommend?
So I think that's a good question. My thought is that the brain is complicated, and as I've described, and there isn't one answer for any one person. I think that the social settings where you're learning that you would get in sort of like adult education is one of the first thing that comes to mind, that, you know, enhancing education and learning at all ages can build a robust brain. You know, there's complicated social factors related to primary education that we can't change, right? One can't change their experience in primary education, you know, when they were younger, but you can absolutely build protection of the brain when you get older and at any age. And I think the other thing I would say is really like exercise. So wherever you are with physical activity and exercise, it's really one of the most kind of like robust behaviors of all of these that I mentioned. Again, it's important together, but if I were going to choose kind of two areas to focus on, I might choose those two.
Excellent. Thank you. Okay, the next question we have, kind of a follow-up question. So as I'm aging, I'm noticing that certain things are harder to do, like physical activity and like the social connections and things like that. So what advice do you have for somebody who's aging and dealing with some of those challenges?
So I'll just start by saying you're not alone. This is extremely common, and I think having some mindful self-compassion that you are not alone is key. There's a universality to that. You know, there's, you know, in the US, this focus on loneliness, just to talk about the social comment here, is a major focus of public health now. The Surgeon General of the US is going around and talking about loneliness, and particularly in older age. So you're not alone, and that means that there are other people in whatever community you are in that are in a similar situation. And I think that, this can be done, fostering social connections can be done in so many ways. I think some of the underappreciated ones are, um, meeting people in a small group and then continuing a connection with them, right? So like a walking group at a senior center near you, there are many of these that go on. Card games. Even kind of low-hanging fruit for people might be, there's probably family members that are not in your area, like a nephew you always liked, that you speak with once a year. Well, make a commitment to talk with them and say, hey, let's catch up once a month. Let's have a phone call, even just to start there, once a month, so that you're making a concerted effort, and then you have a connection with this person. That's the kind of enduring connection that helps the brain over time.
Yes, thank you so much. I really appreciated your focus on the mindful self-compassion, and with some of those ways to make socializing more accessible and kind of setting up some regular check-ins with people. Right. Let's see. We have one question that just came in. Okay, so this one is about mental health and how that can impact our cognitive function. After watching my mother decline with dementia, I find myself feeling really fearful about it happening to me, which obviously isn't good for my mental health due to the stress. How can we reduce the anxiety we feel around the potential cognitive decline?
That's an excellent question. And, there's many people in this situation, to the point where there are people who have studied worry about dementia, and there are like scales that we can look at, for example, called the worry about dementia scale, right? And I think talking about it and awareness about it, and then again, that you're not alone, is key. I also would say that being like proactive about brain healthy behaviors like I've described today, and possibly research opportunities. We didn't talk about that, but for people that have the benefit of being in an area like we have, with a lot of different possibilities of being involved with aging and research, like at our group, like at the Center for Brain Mind Medicine at Brigham and Women's, there's opportunities of even studies that are not intensive, where you would come in once a year to answer some memory questions and that sort of thing. That can make people feel like they have agency and that they're being proactive. And they're also, the benefit of that, just to plug research for a moment, is that there's some feedback depending on the study of how you're doing, and if you needed more care or evaluation in a health setting, because you were showing decline on memory testing, for example, that can be facilitated, right? So there's that benefit too.
Yeah, excellent. Thank you so much. Yeah.
Sure.
Okay, I think that is all the time we have for questions. I have a few closing slides I'll share quickly. So just to review our closing items, I sent the feedback survey into the chat. So if the participants attending this live can click on the chat, you'll see it down the bottom of your screen, and you can open up the link to the feedback survey and fill it out later. And when you fill out and submit your feedback survey, it will link to our website, which has our schedule for upcoming webinars as well as virtual group visit schedule. So we do have another webinar coming up on Tuesday, November 7th from 11 to noon with Dr. Jacob Mirsky and Barbara Canada. They are the leadership team for the MGH Healthy Lifestyle Program. So you can attend that webinar as well. It will be the same Zoom link, and all the webinars are free and open to the general public. We have another webinar coming up in December with Dr. Daniel Hall. It's addressing poor sleep and insomnia. So that's another great topic, as Dr. Gale talked about today, the importance of really good sleep. All right. And the last thing I want to mention, we do have upcoming lifestyle medicine virtual group visits on all sorts of different topics that Dr. Gale touched on today. We have many different series on hypertension as well as brain care. Some of you on this webinar right now may be participating in some of these groups as well. And when you fill out your feedback form and you click submit, it will direct to our website. So you'll be able to see this schedule as well. All right. And I want to thank Dr. Gale for his time today. Appreciate you and
Thank
taking the
you.
time out to be here. And it's been a great webinar and a very important topic for our patients. So thank you so much.
It was a pleasure.
All right. Take care, everybody.